Welcome. Come with me. The doctors will see you now.
Welcome back to Fast Talks with Family Docs. I'm Dr. Vera Vidala.
And I'm Dr. Phil Palmer, and we're continuing our discussion with Dr. Misty Bogle. Misty, thank you for being with us.
Of course.
Dr. Bogle, we had just talked about your time as OFP president, and what we're dealing with is the distrust with that patient and that provider relationship in the last episode. But in general, for family medicine, in your opinion, where do you see family medicine heading in the next 5 to 10 years per se, and how do you think family med providers can prepare for that change?
I think that technology will continue to be part of it. AI, which is part of my decision to leave corporate medicine. I think it probably will get better and be helpful. So I think that as family doctors, we're going to have to move with the technology to make sure that we keep up. I hope that family doctors continue to advocate for their patients and their patient-doctor relationships, and that we don't get turned into more of a referral providers. I think that there's some family doctors that are happy doing that, but I'm absolutely not. I like to investigate pathology and learn and get into the literature and loop around things and learn things that I didn't need to learn in the moment. So my hope is that we continue to grow with technology, that we find a better way to streamline information to younger providers that is good, because the residents sometimes come with bad information in their head. They feel like they know something that it isn't. And so I hope that we continue to streamline the education, that the computer and the information age continues to push forward, and that we find a way to use it well. Yeah. I think AI is in a lot of offices. People are using it for multiple things, whether it be a transcriptionist or to even help them see trends and models. I hope that gets better, because I've definitely seen it not work well.
Yeah. Have you used AI in your practice yet?
No, because that was one of the big things that made me feel like I didn't have control of my license was AI producing diagnoses based on algorithmic things.
Oh, wow, okay.
And so that was really the straw that broke my camel's back, was a number of my patients having diagnoses on their chart under my name that I didn't put there.
Oh, okay.
So I actually have kind of this I'm only just now warming up to the idea that AI can be used effectively and usefully, because I had that experience that felt so bad.
Yeah. There are a few docs within our corporate setting, not at our individual residency practice, but within the corporate environment, that are using voice recognition software for some of their dictations, and was at a conference recently where they were talking about using AI to put in a few bits and pieces of a history and let AI generate a fuller history and description of the patient. Pretty fascinating what it can do, but
it is. It's a little wild, actually. It's a little wild what all it can do. But, I do think that, we're so busy with the relationship and hearing the person out and letting them feel heard that there's room that there are, trends within a chart that you can't pick up on in a 15, 20 minute time frame. A lot of direct primary care offices are using AI actually as their receptionist.
Whoa.
So that's interesting. So the AI has kind of an algorithm where it prioritizes whose message is seen at the top and that sort of thing, and who gets the link to be able to schedule themselves and those sort of things. So that's pretty interesting. And so that group of people have been very open to the AI technology movement.
Yeah, that's really fascinating. Yeah, I've only seen it in the realm of dictation and utilizing it to be more efficient with your admin work. Sure. And it's just very interesting where this is going to go.
For sure.
Yeah. I think the sky's the limit. I think we have to be very careful where we as physicians allow it to go.
Yeah. It needs to be absolutely a tool that we utilize, but it shouldn't be a crutch, and it shouldn't take over, as you implied, the diagnostic role that we have. Yeah.
And that was a glitch. It was a glitch that was found and corrected, but in the moment of that glitch, it felt real bad.
Yeah. So, Dr. Bogle, with all you've done, as a physician, as an entrepreneur, your professional leadership roles, being a wife, being a mom. That's a lot to juggle. That's a lot to keep up with. So reflecting back on your career thus far, what advice do you have for young docs just starting out their family medicine practice as they try to juggle all those different aspects of life?
I don't know that I do it well, to be honest with you. I think my family would tell you I'm like a 5 of 10 in the success role of that. I really do struggle to turn off work. I do try to be very present with my family and very active with my girls. I coach the 6th grade basketball team. So I am very active with them. I mean, I think I may just fall over someday from exhaustion if we're real honest. But I think it's important to schedule your self time.
Yes.
Schedule your spouse time.
Yeah, for sure.
And then make sure you get one-on-one with your kids, because even that family time is important, but one-on-one time is very important as well. For the very young doctors, I have some interesting perspective that can be taken however you would like. But a couple things that I've learned removing myself from a long-term corporate relationship is that corporate relationship can own you. Yeah. And so specifically on Google.
Okay.
So my name, Misty Bogle, MD, was owned by the organization.
Really?
Whoa.
I have had the hardest time regaining myself.
Wow.
And it gets taken back periodically. So there are a couple of things that I tell our residents is that as soon as you come out of graduation, get yourself a yournamemd@gmail website and start your business on Google as yourself. So you're the originator of yourself on Google. Because whoever originates that account is the primary owner forever.
Fascinating.
And so if you try to transfer that primary ownership of yourself, it always will send the backup, is this really you, back to the original originator.
Okay.
Wow.
So like they could change my password anytime and shut me down on Google.
Wow.
I don't think they care to.
Sure.
I mean,
Yeah.
they got bigger fish to fry, right? But that has been interesting. And then same thing with your NPI, your national provider number. If you allow your organization to be the originator of it, they will always be the fall-proof password change email. So that's been interesting that I've actually really struggled to get my NPI reflected out. We think because we're forced to change that quickly, those sort of things, you would think it gets blown out when you make a change, that it would go to the pharmacies, that it would go to the other EMRs. It doesn't. It goes nowhere. It just goes to the government and they stick with it.
Wow.
So I have pharmacies a year and a half later still sending to the wrong place, the old place. I have consultants' notes still going to the old place, those sort of things. So you would think that they would blow that out periodically, but because there are so many EMRs, those sort of things, that doesn't work. It's very idealistic. And so I think owning yourself on Google and being the originator of your NPI so that your own personal email is the backup email for those two things is very important for young doctors.
That's good information. I never would have thought about that.
I never knew that.
It is wild. It is wild.
But I had a similar thing with some insurance or background check database, and I can't even remember the name of it, but with several things that I do and an entity that the residency program's involved in, this other entity sent a message to all of the docs saying, we're trying to re-credential you and you need to go to this database and update the database. And we're all like, we've never heard of this database. How do I log in? And I went in and tried to do it. And it's like, oh, I forgot my username, and it'll send you your username. But then you have to confirm an email. It's like, we've never heard of your email. We don't know what email this is. And it was something that the corporate credentialing office had set up and done when we joined the practice. And so then when we started doing contract work with this other entity, they went through our credentialing office and shared that information with them. But it's someone in the credentialing office, as you said, who acts as each of us to do that, and we give them the information and verify it, but they're the go-to source for updating things and re-verifying it every year, and had no idea things like that were going on.
Which was real convenient for 16 years.
Absolutely. Absolutely.
The people in my previous organizations, credentialing, great people. So definitely not anything on them. It's just interesting to learn that originating email will always be the backup email for password changes.
Yeah.
It's like, whew.
Yeah. Now, the
Crazy.
Coolest thing about doing this with you, Dr. Palmer, is I get to meet people like Dr. Bogle here who just teaches things.
Yeah.
We just never knew.
Yeah.
Like mind blown.
You're mind blown. Like seriously, how do you don't learn this stuff in medical school and residency? No one teaches you this stuff. Dr. Bogle, what about we talked about your DPC clinic and your associated spa. I think a lot of residents are thinking about this when they're graduating, right? No, not even like just current practicing providers, because it's such a an important transition that they could make, because it can drastically change work-life balance, right?
Sure.
What about those people that are thinking about this type of alternative care model? Do you have any advice on how they should approach that, or what they should start thinking about now?
I think it would be very difficult to do coming straight out of residency, realistically. I really do. Now, the positive to coming out of residency and doing it is that you haven't built as much life debt, hopefully.
Yeah.
I always told my residents, don't go get a big house, don't get house broke, right?
Yeah.
So you would have that benefit potentially, but it would be hard to pay back the loans that students take these days. Even my loans are a fraction of what our current residents' loans are. So it'd be very difficult to pay it back. So I've definitely taken a pay cut, and I'm okay with it. I've definitely pinched pennies, and I've had to find ways to keep my overhead low. So keeping your overhead low allows you to not feel like you have to bring more patients in and get back into that same kind of cycle of rapidly seeing patients. My 30-minute and 1-hour visits are wonderful because I can really get down to some things. I don't want to dilute that by having to get more membership payments per month to cover the overhead.
Yeah.
So I think it would be difficult if you didn't plan ahead in residency and in your younger life. If you're frugal and didn't take too much debt, it's very possible and very rewarding. If you have a large amount of debt, it would be difficult because if you choose to take Medicare patients, you have to opt out of Medicare, which kills your moonlighting potential.
Yeah.
Oh.
Right. So you basically can't work for another organization if a Medicare patient's potentially coming in.
Okay.
Yeah.
So it does really hinder your ability to potentially go out and make rapid money if some sort of big life event happens.
Yeah.
So my husband and I are looking at a property right now, and I'm like, okay, well, we got to be careful because I can't just pick up a week in the hospital and get that covered. I can't.
Yeah.
So it's definitely, it's going to require budgeting and doing research. I would say it's a good 1 to 2 years of research of what DPC is, what you want your practice to look like, and developing a business model before you jump in.
Yeah, and that's one of the big foundations of it is having a business plan.
Yeah.
Yes.
Yeah. And learning about business plans.
Yeah, business is, one of my best friends actually followed me about 3 to 6 months after I opened mine. And so he had never had a business. So the knowledge I'd had from forming businesses and developing tax ID numbers and those sort of things, I was like spoon feeding him. I was like, come on, you can do this. But it does. It takes a lot of research and willingness to know those things. So I have less stress in some ways, but more stress in others because I now have the whole business and keeping up with all the membership things that somebody in credentialing did before.
Yeah.
All the licensure numbers, all the things. So I've got lots of calendar reminders for all of those things. So it definitely, you need to make sure you're a business-minded person, but that you can also make sure that you're staying very moral and ethical to that because of that selling a product to patients.
Yeah. Well, Dr. Bogle, appreciate your contributions to the community of Blanchard over the years, but especially your contributions to our podcast this evening and giving your time to share your expertise and experience with us. We really appreciate it. And listeners and watchers, we appreciate you as well. Thanks for joining us on Fast Talks with Family Docs, and we'll see you next time.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.